Today on Tea or Coffee, we're talking about lupus. Lupus is an autoimmune disease. And doing this with us this morning, we have Dr. Aisha Akikugbe. She's a consultant dermatologist and a co-founder with the Labalaba Foundation. Labalaba Foundation is a foundation for people living with lupus. Good morning, Dr. Aisha.
Good morning.
You're welcome.
Good morning. Thank you.
Okay, let us start. What is lupus to start with?
Okay, so lupus is an autoimmune disease, like you have mentioned.
Okay.
It's also called the great mimicker.
Okay.
It's a systemic autoimmune disease that affects all organs of the body. It's also a connective, we call it a connective tissue disease.
All right.
It's a chronic illness, and it affects both the brain, the heart, the lungs, the kidney, the skin, the musculoskeletal system, the joints,
Okay.
and the blood system as well.
Okay.
So what causes it? What causes lupus?
Well, the exact cause is not known.
Okay.
However, there are several factors that play a role. Genetics, environment, even hormonal influences as well. And what we do know is that females are more affected than males, a 9-to-1 ratio.
Okay.
Females of childbearing age, anything from 15 to 45 generally. But of course, you have outliers.
Yeah.
It mimics everything. So you have people who have presented with kidney failure, strokes, people who present with abortions, several missed abortions, so they can present to the gynecologist, they can present to the psychiatrist. You have central nervous system involvement, whereby, you know, they also have manifestations of mania or depression. So they can be mistaken for someone with a mental health challenge. But really and truly, what it requires is a high index of suspicion, knowledge about lupus, and then you screen appropriately so that you can identify them quickly and get a quick resolution to making a diagnosis so that you can start treatment early. So the signs and symptoms are very wide. Okay? But the three common things that they would always complain about would be a fever, could have a rash, joint pains, and there could also be weight loss. There's lethargy, there's malaise. So those typical symptoms are symptoms that everyone in this environment would have. People who complain of malaria or typhoid. So it sort of, mimics the picture. But other things would include a rash, a photosensitive rash, which is mainly on the sun-exposed areas of the body. You could have swelling of the joints. You can have hair loss. You can have chest pain. You can have cardiac problems. You can have what we call frothy urine, protein in your urine. And then I talked about the psychiatric manifestations, whereby you can have depression or low mood. You can have your blood system affected. You could have anemia, have recurrent abortions, miscarriages. So it really just mimics anything in each of the various organs of the body. And that's what, really is important for everybody to know. There must be a lot of awareness because, when I said fever, weight loss, and that malaise, that's typically what you get when you feel like you have malaria or typhoid. So a lot of people keep going to the doctor or go to the pharmacist or seek help saying, I have what I think is malaria. And people will continue to treat for malaria. So really and truly, if you do have symptoms of malaria repeatedly, then you should be thinking, and your care provider, the doctor, should say to myself, what is this? What is going on? And what we want is, to really increase awareness amongst women, of course, girls of childbearing age, school children, so that the level of awareness is increased and people, can ask, I heard about this thing called lupus. I've been having malaria for 2, 3, 4 times. I'm not getting any better. Could I have lupus? At least let's change the conversation round to saying, could I have lupus? That way, at least, you're making the doctor think about it or the person think about it.
Okay, so I have a two-part question. Firstly, I want to know if it's contagious, and then I know there is a type of lupus that the mother can transfer it to a child. So tell us the types, just educate on types of lupus and address if it's contagious or not.
Okay, so it's not contagious.
Okay.
There are different types. When we say systemic lupus, it means that it involves the organs and it has become systemic. You can have just a cutaneous type, which is just isolated to the skin, and that's called the discoid lupus, which commonly affects the skin and the hair, the scalp, the ears, but it's the skin. But that's confined to the skin. However, a small percentage, 5%, can change to systemic lupus, erythematosus. And then within the cutaneous types of, that's the skin types of lupus, there are different ones, which, if you're with your dermatologist and the rheumatologist, you'll be able to identify which particular one it is. It's not contagious, but I mentioned earlier that there is a genetic composition, there's a familial predisposition. So you do have families whereby, mother and child, they may not have the same type, but there is a different connective tissue disease. So a mother might have lupus, another one, the daughter or a sibling or another cousin, could have a different type. But you don't know which it is. But once there is a familial predisposition, then you should ask. You should ask your doctor, can I be screened? I have an aunt who has lupus. I have a sister who has lupus. I have a cousin who has lupus.
This question is quite on a lighter note because unfortunately we find ourselves in a society where superstition is really prevalent. We believe too much in the religious sphere. Now, for people who are beginning to see the signs of lupus, you mentioned the fact that sometimes some people think it is malaria, and they start treating malaria, and then because you can't treat lupus with malaria drugs, it doesn't go. And then some people end up saying, okay, maybe it is a spiritual attack, maybe it is an arrow from the pit of hell, and all of that. So I would like to ask, this question goes to you as a co-founder of the Labalaba Foundation. Do you do orientation for people? Do you go out there to organize seminars and workshops to enlighten people on what lupus is?
Okay, so yes, as I said, the foundation is about educating and creating awareness for lupus. And we have been at this since last year, May, when we first started. There is World Lupus Day, which is in May, and then October, which is Lupus Awareness Month, which is what we're trying to do, to just further make an effort at increasing the awareness. Okay. So on May, at the World Lupus Day, we have had activities whereby you have activities for the healthcare providers because you're trying to increase awareness amongst them, amongst the general practitioners, the nurses, and the doctors. Then we also have activities around the society, so with school children. And then we also have a symposium whereby we have something for the lupus patients, whereby they themselves can come together, do the Living Well with Lupus series, which we have had several episodes of this. And so it's just an opportunity for them to get together, talk about other issues, living well, nutrition, mental health, coping, families. So where the families themselves can come along with the lupus patients and they themselves can discuss the problems that they face. Because one thing that is really important is the support for the lupus patient, or we call them lupus warriors, lupus survivors. Because it is a chronic disease. However, it is not a death sentence. If you're in the right hands, you're doing the right thing, taking your treatment, following the advice of your rheumatologist and your dermatologist and other, caregivers, whichever system is involved, then you can live long and you can live well.
All right. What is the survival rate, though, for people living with lupus?
The prognosis just sort of depends on the complications, and that's why it's important that we try and make an early diagnosis so that you can prevent the complications from setting in. It's the complications that are not good. But the complication, I can't tell you that, you're going to die because of this. You know what I mean? That doesn't happen. But if you have kidney failure, for instance, then you need a transplant, you need, all the other things that go along with that organ having failed. So the key thing is creating awareness. Critical thing is diagnosing early. So that you prevent the complications that will set in.
Okay, we have a caller from Lagos. Janet from Lagos. Hello, Janet.
Hello, Janet.
Good morning. Good morning. Okay, this question is for the dermatologist.
Okay,
so people often say that lupus increases the risk of the cervical cancer. How true is this?
Okay. Thank you.
All right.
Are we going to take that
Yeah,
immediately?
Yes.
Okay. No, there are no direct risks. There's no direct connection between lupus and cervical cancer. But every woman should definitely have a cervical screen, and of course, after a certain age, you should have it every 3 months, every 3 years, and then every 5 years. But you must, definitely look at it. But, there is no direct connection.
Okay, so let's look at treatment options for lupus. What are the treatment options available?
So it would depend on what stage you present at. Like I said, if you have organ involvement, then it will be a multidisciplinary approach to treatment. But there are drugs available. First things first is in managing a patient, before we go to the drugs, it is the understanding, the counseling. Okay, it's the lifestyle changes. Healthy lifestyle is what we preach for everyone. But particularly when you have a chronic, condition, you should eat you should have a well-balanced diet and a lifestyle changes. We have what we call disease-modifying drugs, which are used to treat lupus.
Okay.
There are several of them, and depending on what stage you're at, what organ is affected, then your rheumatologist will place you on them. We usually use steroids. Steroids would be used, you can use them topically for the skin conditions and then oral. Now, the steroids help with inflammation.
Okay.
So, there are a lot of, the inflammation is going on, and that chronic inflammation must be, brought under control. So steroids are used, but they're not used, they're used with caution and controlled as well. Then you have the disease-modifying drugs. So you start off, first of all, with hydroxychloroquine. You have cyclophosphamide. You have mycophenolate mofetil. Other drugs that are disease-modifying, which are going to modify the disease itself. People have to understand that. Then you have more sophisticated drugs, like biologics, when you're not getting much improvement, and, there's multi-system involvement as well. So your rheumatologist would look at it, weigh up. So the treatment is individualized.
Okay.
So no two people, which is something that we'd like to pass on, that no two people will have the same medication. So it depends on what this person is presenting with and this person's complications. So that's another thing, when you're comparing, you want to share, the typical thing, that doesn't happen. It's individualized. I might respond, another person might not respond, so that's it. And there are other things that come along, with it as well. If you have your blood system affected, you might need, to be transfused and things like that. And then, sunscreen. Sunscreen is very important, because of, the sun exposure. So we like to tell them to use sunscreen.
Ma'am, how can you emotionally deal with lupus?
That is one of the strongest points that patients with lupus, struggle with.
Okay.
First and foremost is family support.
All right.
Okay, you need a strong family support, and that's why the education and awareness is very important. You talked about, the stigmatization or people thinking that somebody's thrown an arrow. So firstly, we need people to know that it is not a spiritual attack.
All right.
And, when that notion of a spiritual attack comes about, the first people that surround you are the people that need to correct that. So once all family members are aware and giving you full support, then that is important, because you need your family. I talked about flares, things that cause a flare. Stress is the number one thing. So stress from the family, stress from the inner family, outer family, stress from work, stress from any stress living around Lagos, moving around, the type of job that you have. All these cause flares for patients or persons living with lupus.
To enjoy more interesting episodes of Tea or Coffee, then like and subscribe.
So the treatment is individualized. So no two people, which is something that we'd like to pass on, that no two people will have the same medication.